to you all. Welcome for today's webinar. And we will be looking or discussing at Health Information System for Counties COVID-19. The presenter who will be taking you through this, it's me, Barbara Seger. And again, I'd like to say thank you for taking your time off your busy schedule to be able to join us for this session. Now, to kick this off, as I said, what we are going to be looking at today is health information systems for counties, and this is specifically with regard to the COVID-19. So what are we going to be looking at within this topic of today? We have getting started with a solution offering. So basically, if you are to do the application and then you're provided with this technology, how can you get started? What solutions are provided for you right out of the box? This is what we're going to be looking at. We're also going to be looking at increasing the public awareness of and access to coronavirus cases. What applications can you use to increase public awareness, and how can people access these cases, know more information about these cases? What tools can you put out there? The same goes for communicating the status and the capacity of isolation sites and testing centers. Just again, what applications are available, or what applications can you put out there for people to be able to use? And finally, we will also be looking at managing of food security and what we call the ArcGIS hub site. So now getting started with the solution offering. Our goal today is to deliver a set of focused solutions or content that will help you get started within your organization. So looking at the diagram that we see on the screen, we have the technology, or say let's just say you get the technology. We have people, or we call the staff, who are going to be interacting with the technology, but in what ways and in what capacity? So we're going to start with the GIS professional. So that could be me and you in the GIS field. We have this technology, and then our organizations or people are demanding from us applications to know more about what is really going on. So these are institutions can also include the schools. We have got other organizations, stakeholders, and the applications include things like testing sites, having more information about the facilities, for instance, isolation centers or the testing centers. So as a GIS professional, you take this information, create an application, and then share this information again with the respective people. Then we have the general public, me and you. Hey, here outside, I just want to know what's really the status of the COVID-19, what's really going on in my area, in my country. There are applications that are geared towards the public. Again, surrounding or looking at information about the medical facilities. We have got testing sites or isolation centers. All these can be applications can be put out there for the public and the community to use. Again, even adding the metrics for the COVID-19. Is it for my county, for my area, for my ward? What really is going on? So these are some of the applications that can be put out there. Then we also have the human health and the human services staff. They are busy out there trying to keep us healthy, but what applications also again can they use or be used to monitor the cases, COVID-19 cases around? So we have data collection tools such as a case reporter, just to note a specific case and then give details or information about it. We have the testing sites. Again, what's really happening in the testing sites. They can get information about the number of people who are infected, negative contacts, and all this information. Then finally, we have what we call the government. Now, this bit, I would say the local government in our place in our scenario, sorry. So they want to see how can they allocate resources within the county. But how, for them to be able to do this, they need to know the situation at hand, what's really going on, and then be able to make a decision from these. Now, the applications again geared towards such people or the stakeholders involved, and then they can be able now to make decisions based on this data that they can find from these applications. Now, what you have to know is that you are already making a difference. We are working with several, quite many organizations around Eastern Africa, just to put out tools that the public or the people within their countries, respective countries, can be able to use. So as the situation surrounding the coronavirus disease continues to evolve, we as Esri have been supporting users and the community at large. And in terms of what we're talking of software, we're talking of services or materials that will be able to help you understand, manage, and communicate the impact of the outbreak. Basically, so how can you maximize this investment that you're making with regard to location, based data, and solutions that help you to quickly deploy these capabilities. So solutions, working with these organizations, how have they been able to deploy these solutions? This is something I will take you through, just a demo to show you a bit of what people are doing out there, and then again how you as an organization can be able to get started. So we have the famous one like Johns Hopkins, uses worldwide. They have their dashboard showing the metrics surrounding the key metrics. We have the confirmed, we have the active cases, we have deceased cases, just showing you per country really what's happening. And then we have, as I said, the organizations in Eastern Africa already making a difference. They want this information to be reached within their respective countries. We have Somalia, represented here by Nomad Island. They have their own dashboard just to show these cases. We also have UN Habitat. We have from Uganda, represented by KCCS. Just on my top right, we have, that's actually a screenshot of their Survey 123 application that helps them to gather data from the field. And then we also have Uganda Red Cross, who have actually made their own Aqueous hub site, so people can be able to visit this one site and get information about the coronavirus. Now, looking at the Aqueous Solutions, what is it really or mainly composed of? As I mentioned earlier, we are supporting users and communities, and this is in terms of technology and not technology alone, but also in terms of technical support. So within the solution, we have useful maps and applications. So it's straight out of the box. What we've been doing is liaising with different organizations and trying to find the workflows that they usually have within the organizations, and then work or find solutions, create solutions based on these workflows. So within the industry, instead of you having to start from scratch, you have somewhere you can start or pick up and then proceed onwards in creating your own applications. These applications are configurable and extensible, meaning that they are not permanent. That is, when you pick it up, it doesn't mean that you can change it. You can change it to the way or your liking or your taste. And again, what you really want to showcase to the public. And they are freely available and fully supported as long as you have the technology in place. You can just pick it out of the box and then work with it. We also have community users. Again, just going back to what I said earlier, is that we are working with a lot of you out there, organizations, people, just to get the best practices and know if we come up with a solution, this solution then will be best fit for this specific industry. And this industry here we're looking at is the local government. So we are also offering implementation support when you give you the technology, because this is an ongoing pandemic. We don't want to leave you hanging, that we give you the software then you really don't know how to proceed with it. We are here as Esri just to give you the technical support and to get you started using these tools and technology. So I want us to go through some of these tools and applications that are being used by other organizations, and then just to show you how to get started before you actually proceed. So I'm going to switch my screen to this. So here we have the Johns Hopkins dashboard. As I said, this one's used worldwide just to show the cases around. So here we can see Africa. You can be able to tell the number of confirmed cases, global deaths, what's really happening worldwide. Then now let's go locally. As I said, mentioned earlier, yes, organizations are really up and about trying to get this information to the public, and again, see what information can be useful within. Here represented, I have an example for Somalia. Again, surrounding the key metrics, we have the total confirmed, the active cases, recovered, and the deaths. And then just giving a summary of the female cases, the male, and then at the center we have a map just to show you the number of cases per each region. The same goes for, we have Uganda, again displaying the same, just to show what's really happening within their respective countries. And here for Uganda, this is represented by Red Cross. We have a hub site here done by KCCA. Now, what is a hub site? So I'll say this is like a website, a one-stop shop for information about coronavirus. So you take your applications that you've made, be it a dashboard, be it you're doing installation, you want people or the public to know really what's going on, you can make a hub site and then gather all this information in one site. As we can see here, when I scroll, we have various applications. We also have things like health centers, the ambulance coverage, all this information on one page. What is it that you should know about the virus itself? And then here we have more applications. We have the story maps. We have again more information, again linking to social media. You can bring in your videos, imagery, just to make this a captivating site for the public. And again, as I said, it's a one-stop shop for the public to be able to get information. So basically, how do you get started? You have this technology, but how can you start? We have what we call Aqueous Solutions. To access Aqueous Solutions, you visit or go to solutions.aqueous.com. And then we have a search tab. There are two ways of approaching this. There's a search tab from up here where you can just type or search for COVID-19. So it will bring results with regard to the COVID. And then from there, you can be able to pick it up or proceed working with the solution. So there we go. Here's the response for local government, so you can deploy this within your organization. Another option is just a matter of scrolling the page and then just finding the solutions and getting to the one you want specific. And again, ours is with regard to coronavirus within the local government. So this one is taking just a bit of time, but those are the two ways of approaching this information. So we'll get back to that. I'll just show you in a while. But when you launch the solution, this is what you actually get. So we have some details just explaining to you what's really going on about the solution itself. And then down here we have the requirements such as the software, the applications that are available with this solution specific, and all that. So to launch this, all you have to do is come to the Aqueous Solution Hub, launch it, and then you are taken to such a page where you can now be able to deploy the solutions available. Initially, deployment of the solution was done through ArcGIS Pro. All you have to go access is ArcGIS Pro, then go to your sharing tab, and then getting the solutions, then you now deploy it on ArcGIS Online. But we are evolving and trying to find simpler ways that the community or the organizations can be able to deploy these solutions. And this is one way faster that this solution can be deployed. So I have on my home tab, these are the solutions. We have the response, the testing sites, and then when I go to my solutions, these are the solutions that I have been able to deploy within my organization. So for you to do the deployment, all you have to do is click on a solution, and then all you have to say is get now. When you get now, just sit and relax, and then it deploys the solution to your organizational account. For me, I've already deployed it, so I'll not deploy it once again. If you want to know your solution has been deployed, all you have to see is the green check that I'm hovering with my mouse here. It shows you it's deployed. And then again, when I go to my solutions tab, you'll be able to see all the solutions that have been deployed. So I want us to look at one of the response or the solutions here. This is the coronavirus response. So I'm going to head to my contents page. Here we go. Now, when I launch it, it creates a folder here on my left, just coronavirus response. And then within it, we find all data with regard to that response. So it revolves or surrounds, again, maps. We have applications such as dashboards, we have build applications. We have got the layers provided. So all you have to do is just edit this information to suit what you want to portray. So it's just as simple as that. Getting started, deploy your solution, and then you are able to receive this within the organization. So what are we getting specifically for coronavirus response? So let's look at the in-depth details of what you'll be getting. So it surrounds, we have things like Mill Sites dashboard. We have the biggest one here being a coronavirus case dashboard. So within your counties, you can be able to tell really what's going on, even up to what level. So you can give this information to your respective people within the county. So what is contained here? We have the cases, the map, cases being given here in terms of data, the layers. We also have for the mobile, and then just to look at others, we have school closings and all that. So I'll not do much with this. As we go through the session, we'll be able to see more and more further examples. So here it was, the solution templates. We actually launched one, but there are others. So we have business continuity, we had the hospitalization and PPEs, and then we also had for the first, but what really applies within our area more so lies with the coronavirus response, and then we have for business continuity, and then we have hospitalizations and PPEs. So public awareness of and access to these coronavirus cases. So we have some dashboards that we are going to go through, and then we will just look at how to approach this in terms of how do you feed in data into the dashboards, how do you start creating such information. So this one just shows you an example. We have the Kenya cases. And then we have an in-depth one where we'll be going per county just to see what's really happening with that. And then how do you update this information? We are going to look at a tool called Survey 123 for data collection. So I think we'll just go straight to that. So here I have one dashboard, a very simple one. Here at my further left, we have the confirmed cases matrix with regard to confirmed cases, the active cases, details about the counties, and then we have at the center a map, so showing you the cases. Symbology wise, the bigger the circle, the more cases within that county. And then on my further right, we have recovered cases, things like the number of total tasted, and then deaths. So you can add information such as graphs. As we can see here, we have bar graphs and charts. This one just shows you the daily rise of cases, how it's progressing since when the first incident was recorded. And then now onto another dashboard, my second. This is more detailed as opposed to the first, and this is what we're going to focus on for the demonstration. Again, just up here we have active cases, recovered deaths, those ones who have been reported negative, those who have been hospitalized, and then we have charts and graphs focusing on that, and then down here the main, which is the map, the county map for the county. And up here we have selection tool, and this is just for Nairobi County. So this information is for demonstration purposes. Don't worry about this number of cases. Now we are going to see how to work with this dashboard. As I said, when you deploy it, you already have it. But how do you work with it? How do you populate it? And this is done through the use of that is Survey 123. For you to be able to do the reporting on this, you have to use what you call the Survey 123. So I want us to feed in some information and see how it appears on the dashboard. So we're going to monitor two sets of information, one directly on the dashboard and the other one we're going to monitor using the data. So as I said, there is already a layer, and then this is what we're going to populate. So when I just go to data and then I go to the cases, I'm able to see the number of cases reported. So here from features, this is 5. When I actually update, it's supposed to come to 6 features, and the same for the dashboard, it's supposed to automatically update this information. So let's just go through the application and then we see. So reporting area, I'm going to take Nairobi, and then the date reported, this is today, taking automatically. The time I leave it as default. And then this is the information that we'll be filling. Let me just minimize this. We have the testing information, those ones that have been tested. Cases, we're going to look at the source of exposures, cases by gender and age, deaths, and then also hospitalization. So for starters, starting with the testing information. So we're going to put random values and random figures. So this one is cumulative number of tests. So how many have been confirmed cumulatively? So let me say a figure of 300, and then those have been reported negative. So let me say around, let me play around with a bigger figure. Let me say 900. And then how many cases are pending as of right now? Let me write 300. So automatically populates that 1,500. Case information, so the number of recovered, 6. Deaths, those ones that have passed on, let me write 5. And then those ones that are still in hospitalization, give it a figure of 150. So we're not going to populate daily change, it should add automatically, and then we proceed with the source of exposure. So close contacts, just a random figure. I know these figures will not add up, but as I said, just to demonstrate to you how to go about this. And then those who have done possible travel. So let me write 60. Those ones who are still under investigation, I can give 20. And those who have really traveled, I can give 15. Let me leave these at default, and then I go to cases by gender and age. So the male, here I can say from the number of cases of male, let me give 200. The female, this is 150. And then now we look at the ages. So I can say 39 being the highest, for instance, 49, and then 70 around 20. And then again the deaths. So for the ones who are deceased, how many are male, how many are female? So I can say 3, and then the female 2, and then again the ages. So I'll say in that category. 3 were from here, 2 were from that. So when I'm done, sorry, there's hospitalization. Okay, just random figures. So let me just give that and then say submit. So when I say submit, it should give me a dialog that, hey, my information is submitted successfully. Here it is. So from my cases, this is 5. So I'm just going to reload this to get the accurate information and see if my information has been correctly added. So I'm going to go to cases, and here we see 6, and then the latest here it is for 18th. Now we shall see this information on the dashboard. So initially the active cases were 28. Let's see if there's any changes. There we go. So we can see the active cases has increased, the number of cases, dates, and all that. So these things, as you work on updating this data, all you have to do is just sit and relax, and then it will display on the dashboard automatically. So how do you get started with survey 1 to 3? There are 2 ways of approaching this. One is through the web. We have the web version, and the other one we have the desktop version. So the difference is that the desktop version has very many, or has more capabilities as compared to going through the web version route. These are some of the surveys I have within the account. So this is one, the case reporter. So when I just click on it, I get details or information about it. So I have the overview, just telling me total number of records that have been collected, the number of participants, for instance. And then when I go to design, this is actually about editing, but it will not allow me to do my edits as of right now, because what I did is use the survey 1 to 3 connect, that's the desktop version, to do the edits. And then we have the bit of collaboration. So this, do you want to share with the group? Do you want it to still remain private, though there's no use of it remaining private, because you want people to collect data using this. So you share, you're given a short link just to share with the people responsible. And then we have the analyzation, analyzing each and of every choice that has been submitted. And then we have the data. As I said, I have done mine from survey 1 to 3 connect, that is the desktop, but I'm just showing you what you'll be able to see in case you either choose the desktop version or the web version. Then here I have a map, just to show again some bit of data. But to know more, I have to go to the map itself, and then finally the settings. So that's as simple as that. The other way, you do the installation to the desktop, go to your start menu, and then you're going to search for the survey 1 to 3. After installation, you'll get all this information in in your ArcGIS. So just say survey 1 to 3 connect, and then you can get started. So those are the ways of approaching this. So I think we're going to proceed. So looking at the status and capacity of isolation centers. So this is another application or tools that you can be able to use within the counties. So I have here an isolation center dashboard just to show you how you can be able to map the isolation centers, what type of information can you see within these. And then basically, how are you going to populate information with regard to the isolation centers? There are different ways to approach it. I've just shown you one, which is to sub 1 to 3. We still have other templates and applications where or which you can be able to use to gather this information. After these, let me just combine with the managing food security so that we can proceed with it. So we also have tools for managing of food security. With the coronavirus, we've been told stay indoors, but you know, people can only stay indoors if they have sufficient food or food enough for them to be able to survive. So as a county, what resources can you put out there for in respect to this? How can you monitor such? We have tools provided to do the monitoring, and you can be able to use it within. So I want us to just go back to this and then look at this information. So here I have isolation centers. Just to describe what you're seeing on the screen. On my left, we have details or at least about the isolation centers. At the center, the map being the focus. On my right, we have information about the current capacity. We have details again of each of the isolation center or the with regards to the isolation center. So let's interact with this and see what's really happening. I'm going to choose a county. I'm going to take Mombasa. So let me just type here. Select Mombasa. So here it says filtered my map. I can see only sites from Mombasa region. Let me zoom to it. And then on my left, these are the list of the centers. On my right, I can be able to see now the total capacity cumulatively for the centers, and then the capacity again cumulatively for all, and then details for each of the center. So now let's go to individual centers. So for instance, here when I click on portraits, let's get a view. So it zooms to the place, you can know where it is, and then here I have details about the center, and then there's some photography, some pictures about the center, so you can know what's up. So you can even take in pictures of really the beds or what's happening within again the center, such type of information. And then the current capacity right now, you can see it's at half, just showing me again on these metrics at 50% capacity, and then down here details. So let me take another one like Mombasa Beach. Looks very fancy compared to the others. So here I'm looking at yes, there you go. So that is the location for the hotel. These are the beds. These are the information about it. On my right, giving the current capacity of 25. This is representative of 16, and then details. And then let me finally have one here, Bandari, and then let's see. So yeah, I can see this is the center, the location, current capacity. I'm seeing it's nearly full, and then at 98.3%. So if I was to a health practitioner somebody within the county. I just need, or people working again within the county need to know where to take people within the centers. Then I don't have to make phone calls here and there. I can just know by looking at the dashboard the current capacity of each of these locations or the centers. So I can know already that here I cannot take a specific number of people because it's nearly full. So this is one way of working with the dashboard. Now to populate this again, you can use survey 123, or you can use what we call a geophone. So a geophone, what it does, will be able to populate your information straight to the dashboard, and it's as simple as going to configurable apps, and then from here you can just type geophone and then use this. So survey 123, you can still use it on the web, but it's best also again used using your mobile device, smartphone. So all I have to do is log in with my credentials, get the application, and use it on my phone. Geophone is used best with the web version, so a browser, be able to access and then load or push this information to again your dashboard. So there is one I created, but I think I will skip this for now. So here was the form response. So as I said, it was just as simple as being able to create the application, and then all you have to do is log in and then push this information automatically to your dashboard. Or let me just look for it here, and then you can just scroll through it very quickly. So here we go. Let me just do it very, very fast, just to show you a brief view of how it is. So this is me accessing it. So here we go for the geophone. So we can see the installation centers. So I can add information such as the county, sub-county, isolation center name, the capacity or the current capacity again, and then pick on the location and then submit entry. It's as simple as that. So when you do the submission or add that information, it's automatically populated again to the dashboard. Now, one final other app we have is for the food prices and availability. So here I have the center, again a map, and then just know the type of foods or commodities around: beans, fish, rice. I have a graph here, bar chart for total county production versus the total consumption. And then on my further right, we have what is current, the surplus, and then the price average per commodity. I'm going to take a simple county like Embu. So here I can filter. This is just filtered by the county, and then I also have the select months that I can work with, but for now it's at all. So here I can see information about the commodities, and then the surplus. I can see maize is at surplus, and then here tomatoes, I can now get or gauge the price average that these commodities are being sold at within the community. So are people being fleeced, or really what's happening? And then here the total county production versus the total county consumption. Down being the county production, and the top part being the consumption. So here I can see production, for instance, for maize was quite high as opposed to the consumption. So if it were low, I can be able to tell. So for instance, here stock production, they have a threshold, and then I can see like green grams, the production was quite low. So you can try and see what's really up with that, or how can you be able to intervene. This can be further filtered using the specific months or specific time. So we have, for instance, here information about both the March and April. So I can be able now to see, again, boil down this information to this specific time frame. Now, finally, I want us to look at the hub. I did mention about the hub, a site that is like a one-stop shop for you to get your information. Here, this is for us as Western Africa, and it's all about showing or showcasing what the community is doing with regard to the technology and coronavirus. So here I have some information, I have some figures for the regions, northern, southern, western, eastern, all the information is there. And then here I have just a dashboard to give me the summary cases. I can see for Eastern Africa, this is based on a regions, and just see the cases by country. So it's really high. And then going down, we have the dashboards I showed you earlier, which I focused on Somalia and Uganda. We have various other dashboards provided from other organizations. Then what I also want to talk about is what we call a story map. You in your organization, you work with reports. I know a lot of PDF, I know what documents. Now, how do you create something captivating? For instance, for the public, instead of having to give you a 20-page document, why can't you just give me something I will see very interesting to scroll about? And here, this is where we bring in story map, something captivating. So you're telling here a story, but using maps. In it, you can put in a lot of information that you need. We have digital media. This covers the videos. We also have pictures, high resolution, good quality content you can add into information to your story map. We have applications that you can bring in and then showcase. So here I have one, just an example, COVID-19, the first global pandemic of the information age. So this is just trends and looking at the coronavirus disease trends. So, okay, we can see this epidemic, then pandemic, some bit of information. Then we start from emergent, spreading, being an epidemic, control, and then the end stage of it. This one just showcasing using the colors, symbology, and then here we have now what is the COVID-19 trend in my country. So on my right is loading a map, and then I can now see where my country stands. Is it at emerging stage? Is it spreading? Is it controlled? And then the good thing about the map is also interactive map. So I can click on an area, for instance, my region, this is Kenya, and then just know information and find out what's really happening in terms of the cases. So the trend is spreading, we can see. And then just a bit of information on how they reached about this. So proceeding to scroll, we can see how do I learn about the scope or the trend happening in my country, active cases, and all this information that you can be able to get from here. So I as a public or somebody within the public, I find this way captivating and I can follow through really what's happening. Then down here, I've just displayed other sites or other applications that people are using, and then again link it to media. So as I said, bring all information to one site. And the good thing about Hub is that you really don't have to have those guru IT skills to be able to create your site. You just need to have the template and start, and that's what we are providing. For you to be able to work with this site, there's already a template for them provided when you're taking the technology, and then you can start. So it's as easy as here, if I just press edit, it takes me to the editing site, and then I can start editing. So the settings, just put a bit of settings, and then the header information, the theme, and then the biggest bit here, we have the layout section. So I can bring in applications, the images, text. If there's a survey included, I want it embedded or brought in the site page, it can still be showcased. Contact information, mapping information, charts, all and so forth. So it's a matter of just drag and drop it and then rearrange it. So it's as simple as that to start. Repeating what I said earlier, we are here as Esri technical people, and again, we will support you every step of the way to accomplish this. So that's basically how we get started or use these tools. So just to wrap it up, so when you're getting reports or applying for this donation, we are actually giving donation, you will be getting maps and applications with the info, the solution, the template for Aqueous Hub to get you started. We have got Aqueous Online Hub provided, and then the biggest bit is support. We'll not leave you hanging to figure out things on your own. We will be here to help, just ask for assistance, and we will support you. So basically from the start to the end of how to deploy the coronavirus solutions. So now I think I'm through the session. Thank you very much for joining in. It was a pleasure having you guys or everyone around. So please, if you have any other further questions with regard to the same, feel free to reach out to us and we will be able to assist you. Again, thank you for taking your time and have a good afternoon.